My name is CHAIMA. I'm currently a physician associate in primary care, so I work in general practice. I am so curious about how the body works and understanding the way externally in the environment affects the body. Applied medical sciences appealed to me because it gave me that mix of medicine as well as the biomedical aspect of understanding how a patient's going to present. It felt like a family, and I think that was really, really unique to AMS that I'll always treasure for the rest of my life. I had such fantastic lecturers at UCL, and they inspired me so much that I want to instill in people that with a bit of passion, with a bit of drive, with a little bit of ambition, you too can achieve greatness.
My name is DARA VAKILI. I'm a postgraduate medical student. On the side, work in digital health. I'm a very curious person, yeah. I'm very curious. I like to try and work out or just learn about how something works and try to understand why it functions. I grew up in North London, in High Barnet. When I was younger, I was quite active in sports and activities. Always had a bit of an affinity for science. When I got into AMS, I found the program extremely stimulating. We were being taught the cutting edge of science by people who are professional researchers in what they're doing in their fields. At the same time, we were given this perspective of practical medicine so that we could both understand the complex science that underpins what you'd see in patient-led healthcare. Ultimately, if you're trying to innovate a medicine, a piece of medical technology, if you don't have an understanding of how that impacts patients, you're not really going to be able to get the idea very far. The approach that was being used in the program to expose us to both worlds was very unique in that sense. It's been very, very beneficial.
I am CAMILA MONTESINOS GUEVARA. I come from Ecuador. I knew I wanted to work in the medical field since I was a child. I got influenced by my dad as a scientist. Currently in Ecuador, we face many problems in terms of public health and science, especially because of the financial limitations. But we are also part of a globalized world and a rapid changing community, so this allows us to collaborate with people in different parts of the world. And this is what I'm currently doing. I'm working with research groups from other countries, and we try to come up with solutions to problems like gender-based violence or to improve health outcomes. What I liked from the AMS program was to be involved in scientific challenges, so we could experience how to be a scientist and how it is related to a creative process.
My name is DEENA and I'm a first year medical student at UCL. I was a scout and 12-year-old me learnt first aid and basic life support. It was incredible to learn a skill that could potentially save someone's life or just help them in need. Studying AMS has given me a lot of time to figure out how I work and learn best, and that's something that's going to be useful throughout my medical school now and as a practicing physician. Just organising my time, knowing what extracurriculars I want to be part of, what research I want to be part of. Applied Medical Sciences brings you close to so many experts. You have links with top hospitals like the Royal Free in North London. The academics, professors are so deeply embedded in a wide range of fields, and they're incredibly passionate, and this definitely rubs off on you as a student. I have a keen interest right now in cancer biology, having studied it in AMS, and I would love to continue working with UCL in research and in patient care. You're going to meet others on the program who are on the same journey but could be taking an entirely different route to get there. You will be challenged and you will be invigorated, and one thing is for sure, you'll be well equipped for your next venture or your next step, whatever it may be.